Hi, I'm Dr. Andrew Neville, and I want to talk to you about a topic that I talk about with my patients on a regular basis, sugar. Now, I focus my practice on patients with adrenal fatigue, and anybody with an adrenal issue is going to have a pretty interesting relationship with sugar, like we really like it, myself included back in the day, because your adrenal glands control your blood sugar levels. Like their main job is to raise your blood sugar, right? And if they don't do that well, it drops too much, and then we got to gravitate towards something sweet, right? Most of us know about simple sugars and how, well, they're not great for us, right? Things like, cookies and candies and pastries and soda pop and ice cream and all this stuff, right? When I'm working with my patients, but just even in the general population, you want to limit those simple sugars. I mean, sugar in general, not even just for people with adrenal problems, but in general, it's pro-inflammatory, and it sets us up for numerous diseases, even to the point of metabolic syndrome, insulin resistance, prediabetes, and diabetes, right? There's the carbohydrates, right, also turn into sugar eventually, a little slower than, say, a simple sugar, right? But the carbs like, breads and pasta and cereals and rice and even corn, potatoes, things like that, we can still have those things. You just want to have less, right? So the idea is if you're having a bunch of pasta and meatball, right? Don't have pasta and a meatball. Have this much pasta, a couple meatballs, and maybe throw in a salad there so you can balance out that sugar. Now, so if you're not going to do sugar, right, what are the alternatives? Well, there's these man-made sugars, right, made by a chemist in a lab coat in some big sterile building somewhere. Those are not good options. They aren't. They all have some risk of contributing to disease, okay, whether that's cancer, inflammation, issues like that. So all the man-made stuff you want to be cautious with. There's some decent alternatives, right? Things like stevia or agave or monk fruit or even honey. Now, you don't want to overdo these things, which we can do, right? I've got some patients, look, I ate all these cookies, but they didn't have sugar in them. It had agave or something like that. I'm like, well, moderation, right? Moderation is the way to go. I mean, I can remember growing up, I used to love tea, and I'm not sure I loved the tea or if I loved the amount of sugar I would pour in that tea. I mean, you could stand a spoon up in that tea with the amount of sugar that I would throw in there. And until I figured all this stuff out and as to why, right, because I was running low and I needed some energy, that kind of a thing, I kind of survived on sugar. I mean, you can tell people who have adrenal problems by the way we self-medicate, right, with sugar or caffeine or energy drinks, all those various things, right? So think about moderation, simple sugars. Don't deprive yourself, right? Don't deprive yourself. That's not a good idea either. Occasionally, once in a while, parties, things like that. And then when you're looking at carbs, just lower, right? Just lower. Moderation, balance. I hope that helps.